Everybody, welcome to the Lanterman Coalition's interview with candidates for the next governor of California. We're thrilled today to be joined with Mayor Antonio Villaraigosa. Antonio, welcome. Thanks for coming and chatting with us today.
Thanks for having me. It's great to be here with all of you. I got a short visit back there, and I look forward to coming back after we're finished with this tour.
And I'm Jordan Lindsay, Executive Director of the ARC of California and Chair of the Lanterman Coalition. Lanterman Coalition is a coalition of statewide agencies involved with the advocacy for people with intellectual and developmental disabilities. And we have a small audience here today for those of you watching at home or at work or at your office or wherever. And want to say thanks to our host, the DAC Gallery, which is part of the Exceptional Children's Foundation. And as you can see, the artwork behind us. This is
well, as we can see, they're exceptional.
And exceptional artists. Yeah, they are dedicated to the empowerment of gifted artists with developmental disabilities. And the artwork behind us that you see, just a little fun fact, is that of Paul Greeley. He has been an artist and part of this gallery and program for 50 years, and so he's on display behind us. And so we're happy to have that as our backdrop for our chat today. And we're going to have a few people ask questions as well, a parent, a provider, a member of the regional centers, and others. And then we're just going to have some time to dialogue a little bit about the developmental disability community. So thanks for joining us.
Thanks for having me.
So let's jump right in. The intellectual and developmental disability community, it touches everybody. It goes from poor to rich, from California to all parts of the world, progressive, conservative. Everybody has an experience that is touched by this community. Just want to start out by asking you, what is your personal and or professional experience with people with intellectual and developmental disabilities?
Well, like everyone, I've come in contact with people with developmental disabilities. There's nobody in my family, but certainly friends who have had children who are developmentally disabled. My sister used to work for Protection and Advocacy, which advocates for people with disabilities. And I was Speaker of the Assembly and a member of the legislature for 6 years. And so, of course, I interacted with and worked with advocates, providers, and families.
Great, fantastic. And people with intellectual and developmental disabilities, they face an ongoing fight for civil rights, human rights. Despite there being 500,000 people with developmental disabilities in the state of California. And want to just ask you, how have you shown a commitment to fighting for civil rights and human rights?
Well, I was 15 years old and started out as a community organizer, and I was a part of the civil rights movement from a young man all the way to the time when I became president of the ACLU and then a member of the legislature. And as I said, my sister worked for Protection and Advocacy. I worked at the U.S. Equal Employment Opportunity Commission, who, among other things, had a responsibility for enforcing those rights. And I think you said something, or at least the subtext behind the question is that this is a human rights issue and a civil rights issue, and oftentimes it's not perceived that way.
Absolutely. You mentioned, just in that answer there, equal employment and your history working there. Would love to jump to a question about employment, and actually it'd probably be best if I go ahead and hand it over to a person to ask that question. So I'm going to have, Valeria Hernandez. Valeria, why don't you come on up, since we're already talking about it. And for those, while Valeria's coming up, if you're watching online, hopefully we'll have some time at the end to ask your questions, so type them into the feed.
All right. Affordable housing is a statewide crisis, and people with disabilities who have limited incomes are underrepresented. And talk about solutions. What will you do about that?
You know, this housing crisis is the biggest reason why we have the highest effective poverty rate in the United States. It used to be that homeownership was part of the American dream. Now renting an apartment or having shelter is so difficult for too many people. And as you said, it's not just housing for, you know, the middle class or workforce housing, affordable housing, but it's homeless housing, and it is housing for people with developmental disabilities. And as governor, I want to work with cities and counties to give them back the money they used to have for affordable housing, to put a housing trust fund that would leverage what cities and counties are doing, but they have to have a plan for homeless, for workforce, for affordable, for housing the developmentally disabled, and importantly, permitting reform and zoning changes so we could do more of this faster and for less. Thank you.
And as individuals and families are trying to find housing and trying to increase their income, there is a whole host of adults who are ready, willing, and able to work and training to do so. And a question, if elected governor, how can the state be a model employer for people with developmental disabilities?
Well, Maria Shriver had a program called the Buddy Program. When I was mayor of Los Angeles, I participated in that program. And so I think one of the things we could do is actually hire people with developmental disabilities and promote the hiring of people with those disabilities. And I think all of us have to recognize, and when I walked in here, I thought it was what it is, a gallery. I didn't realize it was a gallery of and for the developmentally disabled. And the fact that there is the kind of talent in this community ought to be something that we would embrace and celebrate. And so I think we need to encourage our employers and certainly lead by example.
Absolutely. It is pretty exceptional, the artwork around here. Acknowledging that, absolutely.
Not better than I could do, I'll tell you that.
Oh my gosh, yeah, I scribble on a piece of paper and that's about as best as I can do. There's employment for getting ready for employment and finding those jobs. There's also the preparation in K through 12. And for K through 12 and education, what is your vision? What would you like there to be for students with disabilities? As governor, how would you lead?
When I was mayor of LA, 1 out of 3 schools were failing. We had a 44% graduation rate, and I was focused on improving that. And we nearly doubled the graduation rates, and we also took that 1 out of 3 failing schools to 1 out of 10. But no city, including LA, and certainly no state, is doing enough for people with disabilities. Special ed has always been a challenge for our state, and I think what we want to strive for is to be a state that's leading the way. And it doesn't mean that we're going to do all that we need to do overnight, but we should be leading the way. We lead the way in so many other things. We certainly should lead the way in this area as well.
Right, great. And in the schools, as well as throughout California, our demographics are changing quickly. And that is, of course, also true then in the developmental disability community. And we are struggling on finding ways to better serve and reach multiple communities. How have you shown in your experience and your leadership in reaching different communities, and also as the state's demographics change, how would you lead and project to engage the disability community like that?
Well, no city looks like California as much as LA does. I mean, we're 44% foreign born. 67% of LA comes from Asia, Africa, and Latin America. We speak a couple of hundred languages. We come from more than 120 countries. And I think that, you know, the ability to work with all of those communities and feel comfortable in is an asset that I bring to the governor's office. But I also worked with organizations, autistic organizations as an example, when I was mayor. When I was in the teachers union, I worked with Lanterman. I worked with special ed, and so I have a comfort level and understand the responsibility of reaching out to every community. I think that's the gravamen of my candidacy. Is I'm a bridge builder, and I'm a uniter.
You mentioned Lanterman, and I don't know if I can think of a community in California that is impacted by the laws and regulations passed in Sacramento and DC and locally more than the disability community. The legislation that is passed in Sacramento has a tremendous impact on the community, and the backbone of the supports and services for this community for the last 50 years has been the Lanterman Act, and we've struggled to perfect it, and we continue to perfect it. But the threat is that in the next 50 years, the promise of the Lanterman Act would be undermined in some way. How, as governor, would you work to ensure that for the next 50 years, the promise of the Lanterman Act, supports and services for people with intellectual and developmental disabilities are available?
I think we have to integrate and bring in the advocates, the providers, the families to a greater degree that we have. I know there's an opportunity to do that with the closing of the 2 centers, an opportunity to figure out what we do with the resources, the land in Sonoma and Costa Mesa, the resources that were otherwise allocated, the money from the feds that could come in. And I think bringing in those providers and putting a plan together that each year tries to make some progress is something I'd want to do. And, not an expert, and so you go to the people who are, and the people who have to live with those resources and see what's the best way to move forward.
Right. And obviously you have a long history in legislating and lots of experience both at the local level, the state level.
Not so much at the local level, but yes, state level.
State level legislating, and can you provide an experience of, because there are many different groups within the disability community, obviously. You have the self-advocates, parents, providers, regional centers. You have all different types, education, of a time when you have brought different communities together, different groups together to move forward on a specific issue or legislation.
There were many times when I brought broad stakeholders together to address issues, challenging issues for the state. I can't think of precisely one regarding the developmental disability community, but that's what I did, and I think that's what I bring. I mean, when you're Speaker of the Assembly, when you've been mayor of a city that's the most like the state, I think you come with an experience level and a can-do level that ability rather that, and when you come from the civil rights movement and know that in many ways people didn't see this as a civil rights issue, I think you're more sensitive to trying to move forward in a way that does set the standard for the nation. I can't speak of a specific example when I was Speaker because, to be honest, I had so many issues but I can tell you that I have that experience of bringing people together to get things done.
Right. I think this time we're going to bring up a few people for questions, and again online, if you're there, you may have some time for questions at the end, so you can type them into the feed. And so next I want to bring up direct support professional, Kristen Adami, who will ask a question.
Hello.
Hi.
My name is Kristen Adami. I've been working with VIP for about this last 7 years. I'm a job coach. I provide on the training and support to individuals with developmental disabilities. My question is this: how can the state inspire workers to select a career in providing direct support to people with developmental disabilities when the current rates of pay are not aligned with the expertise required to effectively carry out this work? Such as a new direct service professional that has little to no experience will soon be making the same amount as I do, since the state of California will not fund the wage compression that is occurring as minimum wage increases.
It was almost a catch-22, right? I mean, I'm running for governor because I believe that we need to grow together and that we need to grow more middle-class jobs. And I think the legislature, I mean, we wouldn't have a compaction issue if it wasn't that the legislature realized that the minimum wage was way too low. And so they tackled that first. And now as a result, you have compaction. You have people that have been working in the field for the same amount of time and they're getting paid what the new people are coming in, and you have their supervisors who aren't getting paid much more. And so rather than criticize the legislature, and I certainly wouldn't for what they did, I think they did something important. Mm-hmm. We do have to reward work. I think we're going to have to address the compaction issue because, as you said, we want to encourage people to go into this field. I think we also have to focus on training to make sure that, you got to make the case oftentimes to the public why you're doing what you're doing. But I think there was the right to start with the minimum wage. The next step is addressing the compaction issue and training to make the case for more funding.
Great. Thanks. Next, we're going to have Grace Huerta come on up. Grace Huerta, a parent, another kick-butt advocate from Bakersfield.
Yes, thank you. Family members often play the role of primary caregiver for the child or sibling with a disability. What proposals do you have to better support families whose work and devotion make it possible for their loved one who chooses to remain at home, reminding Mayor that as caregivers, parents, we don't clock out. It's Monday through Sunday, we're on call every single day.
We've dealt with this issue with in-home supportive services, and there are a lot of people, as you said, who have chosen to stay home, and knowing that it'll have an impact on, the family budget because they're not working outside of the home, but believing that they're the best providers of care for those family members who need that care, and I think the state has to acknowledge that. You're in many ways, as you said, you're not only a family member, but you're an employee, you're working, and you're providing a benefit. If you weren't there, somebody would have to provide that benefit, and the cost of that care would be much greater. So we should look at it as actually an investment that's finding efficiencies in the system. And, I think the goal has to be to make progress. Anybody who comes here today and saying that, they're going to solve this issue, really not being truthful. It's a hard issue because the cost is really high, but so is the cost of not addressing the issue. So I see it as something that we should look at it from short-term, mid-term, and long-term. And certainly people like yourself are really saving the state money in a lot of ways. And we should figure out how we invest in that.
Thank you.
And Cynthia Fernandez, who represents and works with Easter Seals throughout Southern California.
Hello.
Hi.
As service providers dedicated to serve people with developmental disabilities,
A little bit slower.
slower? Okay. Service providers dedicated to serving people with developmental disabilities must accept rigid state set rates. Currently, there is not a good way to adjust these rates in response to increases in certain costs, such as local minimum wage. Do you believe those rates should reflect all the costs of doing business, including local minimum wage?
Yes, I do. But kind of like the last two answers, I mean, let's be honest, we've been struggling with this issue for decades. And, you know, nobody running for governor is going to solve that overnight. But I think we need to realize the system is broken. And back in, you know, during the Lanterman days, we were actually leading the nation. We were, you know, kind of setting the standard. And since then, we've kind of began to trail back. And I think the goal should always be leading the nation. So all of those things should be taken into account. There's a cost to it, and we should figure out what are the right investments to make to demonstrate that the benefit is greater than the cost. And I'm looking forward to doing that.
Great, thank you. And Amy Wessling from the Association of Regional Center Agencies.
California's developmental services system was founded on the idea of having local regional centers work with service providers to meet local needs. What experiences have given you the best understanding of the importance of responsive and innovative locally based ideas?
Well, it's not just in this area. I think almost every area, local decision making, local strategies to address issues are almost always better. I was Speaker of the Assembly, and I saw things from 100 feet above the ground, and then I became a council member and mayor, and I saw it on the ground. And I think there's no question that going to regional and more local strategies versus a one-size-fits-all makes the most sense. What I would want to do is, again, work with the experts, with the stakeholders, to kind of figure out what's the best way to deliver that, while at the same time getting accountability, because you want to make sure that the money you send locally gets spent right, so that you can make the case to make more investments, and that's something I'd be committed to.
Thank you.
Great. We're going to take a few questions from those of you watching online, and then have a little bit of time at the end to wrap up. Thanks. Mary Platt, who is from Ventura, asks, what can we do if the federal government cuts Medicaid, which is a source of federal funding for community-based programs for this community?
Well, actually, I've talked a lot about that in the course of this campaign. You know, there have been people who have focused on, you know, a new delivery of health care, single payer that would double the size of our budget. And while I say I support that in concept, we got to focus on the fact that 2 to 5 million people could lose their health care as a result of proposals from the House, the Senate, and the Trump administration. And I want to make priority number one protecting the 2 to 5 million, because a third of the people who have health care in the state have Medi-Cal. I also want to address the fact that even if the feds don't cut health care, right now about 93% of Californians have health care. As I said, a third of them Medi-Cal, but a lot of people on Medi-Cal don't have access. And they don't have access because of low Medi-Cal reimbursement rates for doctors. They don't have access because in places like the Central Valley, there aren't enough access to community clinics and hospitals and primary care physicians. So I want to work on health care as a right, not a privilege. I want to provide more access to health care. I think we need to focus a lot more on primary care, prevention, and finding efficiencies and cost containment measures like Kaiser and the Cleveland Clinic, so we can expand healthcare to more people.
Great. Was there any more questions online? All right. There was also talk when we were mentioning the regional centers and leading from local, and also the Lanterman Act. There's also a rate study that is being done currently by the Department of Developmental Services to look at the entire structure of rates within the state. And should the rate study come back and give recommendations that improvement should be made here and there, how would you go about examining a study that comes in and leading to implement any changes that were positive?
I think if you asked the providers, the families, the advocates, what is the rate study going to say? It's going to say that the rates that we provide for these services are too low. I mean, I think, we don't need, you need a rate study, but you don't need a rate study to tell you that. I think what I'm hoping is that we'll have, with that, I think what needs to follow that is what's the best way for us to get there. And in terms of rates, vis-a-vis services, where are the places where we get the most bang for the buck? And how do we do this in a way, as I said earlier, where we're kind of leading the way and, not trailing most states? And, in a budget of finite resources, prioritizing is really important. But in a world where I think we all have to acknowledge we're not doing enough in this area, I think the mantra has to be, let's make progress.
Great. I think we got time for one more from online, and then we'll let you close. Thanks. Karen Jones asks, the unemployment of our population is well over 80%, and some want to eliminate certain types of employment for the population. Do you think you can use the office of governor as a bully pulpit to increase employment opportunities for people with developmental disabilities?
When she says unemployment rate, she means unemployment rate for people in the developmental disabled community, right?
I believe it's well over 80%, yeah.
Yeah, it's well over 80%.
Yeah.
Yeah, I said earlier, I think we need to lead the way, lead by example. We should, the state should be hiring folks with developmental disabilities. We should be encouraging cities and counties, school districts, and other public entities to do the same. And we should look at, innovative proposals like maybe incentivizing monetarily or otherwise employers to employ people in the developmentally disabled community who are particularly hard to employ.
Great. And just want to allow you to close. Really appreciate you coming and chatting with us today on why you as candidate would be the best governor for the developmental disability community in California.
Well, first of all, thank you. I mean, as I said, when I walked in, I thought it was just a gallery. I didn't realize this was a art gallery of the work of people in the developmentally disabled community. I didn't realize there's a school and classes taking place just behind those walls. And I think what coming here reminds you is that these are people with talent. And they're people with the same rights that we have, human rights and civil rights. there's a reason why there are advocates, because we tend to need advocates for those who are in communities of high need. And this is one of those communities. And I started out at, as I said, at 15 years old as a community organizer working with the farm worker boycott. Never worked in the fields. Didn't speak a lick of Spanish, but I knew I had a responsibility to stand up for these people. I could have worked anywhere, but I worked, you know, with the East LA Health Task Force in a community with low insurance rates and high diabetes and obesity levels. I worked at the Center for Law and Justice, working to provide access to justice for the poor. I was at the U.S. Equal Employment Opportunity Commission, enforcing our nation's civil rights laws. My entire life I've stood up for people who needed a voice. And as I became a public servant, that ability to speak out for them, but also to bring people together to get things done for them, is something that I think has marked my time in public service. And so I think I'm particularly unique, because for me, these people aren't invisible like so many of us. It's not just the developmentally disabled community that's invisible. There are too many people invisible to too many. And I want to be a governor that lifts us up, that stands for the proposition that a great state's a state where we're growing together, that we can't leave so many people in poverty, so many people homeless, so many people without health care, so many people without the things that most of us take for granted. And I'm ready to fight for them, and thank you for having me here today.
Antonio, thanks so much.
Thank you.
Appreciate it.